The Kendall SCD system is composed of 3 separate components: a controller, sleeves, and tubing that is used to connect the controller and the sleeves. The sleeves are available in thigh and knee length sizes. Before applying a sleeve, it's important that you measure the patient to identify the appropriately sized sleeve. For thigh length sleeves, measure the circumference of the patient's thigh at the widest part and then refer to the Kendall SCD system sizing chart to determine the correct sleeve size. To place the thigh length sleeve, first orientate it with the back of the patient's leg, then wrap the sleeve around the leg, fastening the Velcro closure tabs. Make sure to leave approximately 2 fingers of space between the deflated sleeve and the patient's leg. Ensure the gap in the thigh-length sleeve is positioned at the patient's knee to avoid compression at the popliteal area. For knee-length sleeves, measure the circumference of the patient's calf at the widest part, and then refer to the Kendall SCD system sizing chart to determine the correct sleeve size. To place the knee-length sleeve, orientate it with the back of the patient's leg, then wrap the sleeve around the leg, fastening the Velcro closure tabs. Make sure to leave approximately 2 fingers of space between the deflated sleeve and the patient's leg. Ensure that the device is securely fixed to the bed and that there is adequate airflow to the vents located at the power cord cover and below the tube set connection points. Plug the tubing sets into the back of the controller, and then route the tubing towards the patient's limbs, being careful to leave access ways clear and eliminate tripping hazards. Plug the tubes into the sleeves, checking for kinks and ensuring a secure attachment. Plug the controller power cord into a properly grounded socket. If no power supply is available, the controller has a battery that will provide the controller with up to 8 hours of power. Press the power on or standby button to begin operation. If using leg sleeves, no further intervention is required as the controller will automatically detect whether a knee-length or thigh-length sleeve is being used, and then begin to deliver the set pressure pattern of 45, 40, 30 millimeters of mercury pressure. During the startup process, the Port A and Port B leg images will blink to indicate the default garment configuration, which is leg compression. A graphical user interface allows for an intuitive operation, including animated error code resolution. While a reduced noise output is sure to keep nurses and patients happy. The device also has a compliance meter with patient sensing technology, allowing clinicians to track the patient's true wear time.